I'm Maura Fitzgerald, and I welcome you to SGA this morning, wherever you are on your journey. I've been a parishioner of St. Joan of Arc for over 20 years, and I'm a leader in the SGA chapter of the statewide network of healthcare for all Minnesota. As an advanced practice nurse in pediatrics, I saw firsthand the struggles families have when they didn't have access to health care. My experience and my Catholic faith calls me to advocate for a fair and just healthcare system for all. I am also very glad to welcome our guest speaker, a longtime champion for reform in the healthcare system. Senator John Marty is a graduate of St. Olaf College and is a Minnesota state senator. He is the author of the Minnesota Health Plan, and we are grateful for Senator Marty's conviction that quality, affordable care is an essential part of the common good. It is my pleasure to welcome you, Senator Marty, to St. Joan of Arc today.
Thank you. The day after many people around the country gathered, millions of people, for No Kings rallies yesterday, I was pleased to be at one. I was pleased to be at one in White Bear Lake, and just reading the signs was heartwarming and encouraging and so on. And as the gospel message you'll get to hear later about the widow who was persistent, it reminds us why we have to persist more than ever when the time seems most challenging. I was raised by parents who taught us that each of us has what we would call in Christianity a vocation, a calling to live our lives in service to others. And regardless of our occupation, our volunteer work, our role in society and the world, our calling is to serve our neighbors and all of humanity. As a longtime public official, my job is to write laws as a state senator, but our vocation in that and every other way is to serve others. Our faith and values shape who we are, and they motivate, inspire, and encourage me to love my neighbor as myself. And for almost 4 decades, I've been engaged in the, what you might call, rough and tumble world of political process, trying to work for a better future. And in those 40 years, again, I keep thinking every time you feel a setback and we're moving further away from justice for all, to feel, let's remember that message of persistence. Of course, when we talk about religion and politics together, the first thing that comes to mind these days are Christian nationalist politicians that some churches promote from the pulpit, politicians who promote their right-wing ideology. They call them God's chosen leaders. And those Christian politicians and their supporters expressly want to impose their religious beliefs on everyone else. I find that ironic and disturbing that some of these folks who say they want a small, limited government that's unobtrusive to us should intrude in the most personal matters of people's lives. And I think that it's never the role of government to impose one's religious beliefs on others. Our role is to teach others to love and respect people. Throughout history, understandably, because it's the nature of humanity, there have been many political leaders and politicians who've had a complete lack of concern for the well-being of others, people who are hurting, people who are down and out, people without housing. But using the power of government to try and change things is not something they all care about doing. But this seems to be the first time in American history we actually have some political leaders who are actively trying to harm others. It was going to be, we're going to go after criminals, but pulling people off the streets and taking them into custody even without having done anything wrong. What happens to our country? I think about 6 or 7 years ago, you may remember an iconic news photograph of a father who had his arm draped around the shoulder of his 3-year-old daughter lying face down dead in the mud, trying to enter the U.S. in a river. Who among us, in seeing a photo like that, doesn't feel That's wrong. That's tragic. What can we do to help? Our call to love our neighbors as ourselves is very clear in what we have to do. But then last year, during the political campaign, we heard the president falsely say an entire community of immigrants was eating our cats and dogs. Bizarre. And they acknowledged it was a lie. But it tells a story, they said. And it tells a story that they're not human. And we try and dehumanize each other because if we don't see them as human, we don't care. Now, something that I think was unimaginable 5 years ago is happening where ill-trained or untrained law enforcement agents in unmarked vehicles with masks on detain people without probable cause, largely because of their skin color or their ethnicity, because they might be in the U.S. without legal documentation. And this is a total loss of constitutional rights, and it's been swift. But many of us, hasn't hit us personally yet, so we don't worry as much. But if some people lose their constitutional rights, that means none of us have constitutional rights that mean we'll be treated better. And this new authoritarian hit is on a society where many people were struggling beforehand, struggling to feed their families or find affordable health care or find fair housing. During the last 5 years ago, before all this hit, about half of Minnesotans, 45%, reported in the previous year they were unable to get care they needed because of cost. 45%. Tens of thousands of Minnesotans have debt from medical care they can't possibly pay off. But the cost isn't the biggest problem. The consequence is people die when they don't get the care they need. Now, last summer, as part of the big, bad, beautiful, whatever they called it, Bill H.R. 1, which was focused on giving $4 trillion in the next 10 years in tax cuts to people who don't really need the money. Because they didn't feel they could pay all of that off with more debt, they only paid about $3 billion in more debt. They're taking about $1 trillion out of health care for the poor. Many of those savings are not actually pushing people off, it's putting them through paperwork and stuff, so even though they qualify, they can't get the care they need. So these folks have been hurting. Now they're worried about some people being hauled out of their homes, some people losing their jobs, some people, their housing costs go up, their health care is going away. Life is bad and getting worse. So how do I, as a public official, how do each of us, whatever our work, whatever our situation in the world, live out our calling in these times? How do we attempt to faithfully serve our neighbors across the state and around the world? First, we have to acknowledge the humanity of everyone. We are all children of God. All of us deserve respect. Nobody can dehumanize a child of God honestly. Second, recognize in public policy we're going to disagree. We are going to disagree, and that's okay. We can learn from each other by listening to each other, not by shutting others down and locking them up and taking away their vote. Third, recognize loving your neighbors yourself means we want them to have the basic necessities of life, the human rights everybody needs, decent housing, health care, food. And fourth, recognize there are 8.2 billion people on the planet, and it's a finite planet moving through space with limited resources, and we have to recognize that we are borrowing this planet from future generations. We do not own it. Fifth, we have to seek a system based on fairness, where the system isn't rigged to block participation who disagree. But in concrete terms, what does this mean? What does this call to others mean? For me as a state senator, let's take the issue of health care reform. Dr. Martin Luther King, many decades ago, said, of all the forms of inequality, injustice in health is the most shocking and inhumane. And so we can be proud. 30 years ago, Minnesota created Minnesota Care to cover many low-income people. The Affordable Care Act covered many more people nationally. That's all important, very important. We can't do without that. But under the current system, even with those things, people are dying from a lack of health care, literally. Those deaths rarely make the news, but they happen so many thousands, tens of thousands of Americans die every year because they cannot access health care. We can't treat that as acceptable. We can't keep tinkering and, well, we'll make a little improvement here. Well, we have to do those things, but that's not sufficient. We have to do more than that. Problem isn't a lack of spending. We spend literally twice as much or more than twice as much as any other country per person on health care, with about 10 or 12 exceptions. We spend far less than this, but more than half. We could cover everyone. We could take care of everyone if we prioritize that over those who profit at the expense of others. 18 years ago, I became chair of the Senate Health Committee, and seeing no proposals from either party to cover everyone and make sure everyone was in, with no exceptions, I introduced what I call a Minnesota Health Plan, not a fancy name, but something I think we need to adopt. It would be required to meet some basic principles, cover everyone with no exceptions, cover all medical needs, including mental health, including addiction, including drug costs, including vision, health, hearing, everything, and allow patients to choose their medical professionals and make the decision-making between the doctor and the patient, not between insurance company or employer or government or somebody else, but let people get the care they need and ensure there are enough providers to meet the need. Nobody's in charge of that because we don't have a system. The approach of this Minnesota Health Plan is fundamentally different. Again, for once, you wouldn't be, how am I going to pay the bills? How am I going to do this? Everybody pay for it, but it'd be based on ability to pay, so those who can't afford much would pay less. We don't want any barriers to care, which is what we've been doing for decades. Minnesota Health Plan is something I'm very passionate about and totally, completely continuing to work on it. I'm not willingly leaving, even though I've been around longer than I intended to be. I'm not willingly leaving until we pass health care for all people. But I'm not an uncompromising ideologue. I don't need the Minnesota Health Plan. If somebody else has another way of making it so all things are covered for all people and they get the care they need, I'm happy. I'll sign up for it. I just want to make sure it's not about some ideology. It's about principles and policy that will make people get the care they need. And what's required of us, we're told in Prophet Micah, but to do justice, love kindness, and walk humbly with our God. In a democracy, we are all responsible for our society's government. Government is not them, it's us, collectively. If those in power who we elect to make decisions on our behalf are doing something that doesn't do that, it's our responsibility to work to help people get the help they need, but also to speak out, and speak out vocally, and speak out persistently as the widow in the gospel does. That's why it was so encouraging to see, I think there were reports, 7-8 million Americans out protesting yesterday. So whether the issue is health care, or protecting asylum seekers, or racial disparities, or climate, it's our calling as Christians to serve, not just one-on-one, though one-on-one is equally important, but also to set policies and advocate for those who are struggling, not for some political ideology, but for principles and policies that will treat others with the kindness and justice we're called to serve. So I encourage you, take a look at the Healthcare for All Minnesota folks in the back, talk to them, get involved in making change, get involved in indivisible, any kind of groups that are speaking out, because we have an obligation to care for our neighbors in need, and that's the message of the gospel, and as the gospel says today, be persistent. So thank you.